So let's just get right to it. The big one. Can your DNA predict your future? I mean, is your whole life story already written in your genes? Can a simple test tell you exactly what's coming for your health?
Well, the short answer is not exactly. It's not some kind of crystal ball. Think of it more like a weather forecast. A really, really personalized weather forecast, just for your body. It's not saying it's definitely going to rain, but it might tell you there's a good chance, so, maybe pack an umbrella.
And that's the idea we're going to run with today. Let's call it your genetic weather forecast. We're going to break down what genetic predisposition really means.
This quote just nails it. It is all about probability, not destiny. It's the difference between a meteorologist saying there's an 80% chance of showers versus saying it will rain at 3 p.m. sharp. One is a likelihood, the other is a certainty. And genetic testing, it's all about that likelihood.
Okay, so what's the official name for this stuff? It's called predictive genetic testing. And it does exactly what it sounds like. It looks at your unique genetic makeup, all those little variations, and then it estimates your predisposition, basically your natural leaning, towards specific traits or conditions.
Now, we've got to be super clear about something here. What we're talking about, predictive testing, is all about looking into the future to help with prevention. That's totally different from diagnostic testing. That's for right now. That's when you already have symptoms and your doctor's trying to figure out why. Two completely different goals.
All right, so how in the world do they actually create this genetic forecast? Let's get into the nitty-gritty of how the science actually works. This is the really cool part.
First thing you should know, not all DNA scores are built the same way. A lot of conventional ones are based purely on statistical links. This gene shows up a lot with this condition. But the approach we're looking at here goes a step further. It's less about just the statistics and more about what the genes are actually doing, their biological job.
So what's the secret sauce in this more advanced score? Well, it's a whole bunch of things. They look at the actual function of the gene, the biochemical highways it's on, even how your ethnicity and sex play a role. And get this, it's all backed up by a deep dive into more than 150,000 peer-reviewed studies. Wow, talk about doing your homework.
And the process to get from your DNA sample to that final report is intense. It's this whole 6-step journey. They compile everything, run it through some serious quality control, analyze it all, classify the evidence, integrate it, and then, finally, create your report. It's a really thorough system from start to finish.
Okay, so the science is done, you've got the report in your hands. Now what? This is where we really have to hammer home that idea of certainty versus probability.
This chart makes it so clear. See on the left, for some rare disorders caused by a single gene, the prediction can be almost certain, like up to 99% certain. But for most of the stuff we think about, these complex traits on the right, they're polygenic. That means lots and lots of genes are involved. And for those, your personal risk could be anywhere in this massive 1 to 99% range.
And check this out, the actual lab technology, the machines that read your DNA sequence. They are ridiculously accurate. We're talking more than 99.99% accurate. So the machine is definitely not making a typo when it reads your genetic code.
But, and this is so important to get, just because the machine is accurate doesn't mean the prediction is certain. The technical accuracy of the lab is one thing. Your actual personal risk for something complex, that's still somewhere in that big 1 to 99% bucket we just talked about.
So here's the main takeaway, the thing to really remember. Technical accuracy is not the same as predictive certainty. Simple as that. The test reads the letters right, but reading the letters isn't the same as knowing the whole story.
Okay, so after all that, is this kind of thing actually for you? Let's talk about who can really use this and what you should be thinking about.
Well, it turns out a pretty wide range of people might find this useful. If you have a family history of something, it could be a real eye-opener. Or maybe you're just really into optimizing your health and want to be as proactive as possible. We're even seeing athletes use it to dial in their performance, or parents who want to get a super early look at their child's health profile.
And here's a really interesting point. Your DNA doesn't really change, right? So this is pretty much a one-and-done test for life. And that means the earlier you do it, the more runway you have to actually use the information. You get more time to make those small tweaks to your lifestyle that can add up to a big impact over the years.
Okay, let's talk about the elephant in the room. Anytime we talk about DNA, the big question is always, but what about my data? Is it private? Is it secure? And it's a huge deal for sure.
And you should absolutely be asking that. The good news is the standards are really high. We're talking full compliance with big deal privacy laws like HIPAA and GDPR. Plus, and this is key, your raw genomic data gets anonymized once the report is done. And most importantly, you own your data. It belongs to you, period.
So let's circle all the way back to the main goal here. This isn't about getting some scary, unchangeable verdict about your future. It's the opposite. The whole point is to give you information that empowers you. It's a tool to help you work out strategies, maybe with your doctor, to delay or maybe even prevent the onset of things you might be genetically wired for.
And that really leaves us with one last question, and this one's for you. If you had your own personal genetic forecast in your hands, would it change your day? Would you make a different choice for lunch? Would you go for that walk? It's a powerful thought, and it's really what this is all about.